The moment you have moderate sleep apnea, which is an index more than 15, then you start wondering whether you need a little more treatment, which is positive airway pressure. Now, positive airway pressure is basically a small mask attached to your nose, sometimes just attached to the nostrils, a little tubing and a little machine next to your bed. And I know it looks scary when you open up the internet and you see these devices. Many people think they're on their last leg when they're using it, but much to the contrary, all it does is push the air in your bedroom into your lung. As simple as that. And because people are so scared looking at it, they don't take it. And it's very sad that many patients don't take the treatment because of the size of the device. I always compare it to an inhaler for asthma. The medication is microgram, but the inhaler looks big, so people get scared to use an inhaler, yet an inhaler is much safer than a tablet. Likewise, it is much safer to take any tablet than it is much safer to take positive airway pressure than any tablet that you could take. And if you look at the cost of the machine, so the initial cost could vary anywhere between 40,000 to 60,000 rupees, but that's the cost of the machine. If you have diabetes or hypertension, it's going to cost you more than that per year easily than buying that machine. And that machine is just like the principle of a vacuum cleaner. It's just the opposite. It just pushes air under pressure and it'll be comfortable. And trust me, if you get a sleep engineer from any of the companies that make the machine to sit with you for a night and just before you go to sleep to see that the mask fits well, you would never have slept better in your life before that if you have sleep apnea. And many patients, most, tell me that why didn't I use this machine 5, 10 or 15 years ago? By then they've already developed diabetes, hypertension, cardiovascular disease. And suddenly when they start using the machine, their blood pressure medication very often and diabetes medications start coming down. And that's why it is so important that we first get that diagnostic test done, then speak to our doctors about treatment, whether only lifestyle, tongue exercises will help, or whether you need to use positive airway pressure, which, as I said, has almost zero side effects. It's just the air that you breathe in your bedroom at night being delivered to your lungs, which should be happening and which isn't happening.